Hello, I'm Dr. Jason Sutherland, a family doctor in Sudbury. As a physician, I have an interest in the health of all Northerners, and I'm committed to reducing the impacts and number of cancer-related deaths through our cancer screening programs. Too often, patients put off cancer screening. We hear patients say, "I feel well. Why should I worry about cancer screening?" Today, my message to you is simple. It's time. It's time to put your health first and to say yes to cancer screening. Cancer screening is testing done on people who may be at risk of getting cancer, but who have no symptoms and generally feel well. Screening can help us find cancers when they are small, less likely to have spread, and more likely to be treated successfully. Let's take a closer look at lung cancer and the importance of screening. The lungs are a large organ in our chest that take in oxygen from the air and release carbon dioxide from our bodies. Lung cancer starts in these cells. The new Ontario Lung Screening Program reminds us that lung cancer is one of the most common cancers, and it is the leading cause of cancer death in Ontario. Smoking is the biggest risk factor for lung cancer. If you are at high risk of getting lung cancer, getting screened regularly can greatly lower your risk of dying from lung cancer. Too often, by the time lung cancer is diagnosed, it has spread to other parts of the body or is too big for treatment to have the best chance of working. We now have an effective way to screen people for lung cancer to help us find some lung cancers early when treatment has a better chance of working. In Ontario, it is recommended that people at high risk for lung cancer undergo yearly screening with a special CT test. The Ontario Lung Screening Program is new and not yet available everywhere in the province. Health Sciences North in Sudbury took part in a pilot of lung screening and continues to offer the program to people in the Northeast. You may be at high risk of lung cancer and qualify for screening if you are 55 to 74 years old and have smoked cigarettes every day for at least 20 years. It does not have to be 20 years in a row, which means that there could be times when you did not smoke. If this is true for you, then your family doctor or nurse practitioner can refer you to the Ontario Lung Screening Program. This is step one in finding out if you are eligible for screening. Not everyone who is referred will be eligible for screening. During step two, a screening navigator from the program contacts you to ask further questions about your health and history. This includes questions such as any lung conditions you might have, your family and personal history of cancer, your weight, and more. The answers to these questions determine if you are at high risk and whether you should undergo the screening test with a special type of CT called a low-dose CT scan. During the scan, you lie on an open table that passes through a large donut-shaped machine called a scanner. The scanner uses a small amount of radiation to take detailed pictures of your lungs. The test only takes a few minutes and is not painful. There are no medications or needles given during the test. A radiologist, a doctor who specializes in looking at these scans, will examine your lung pictures. Most people will have a normal scan and will be reminded to return for screening in 1 year. If any changes are seen on your scan, you may need further follow-up tests, which will be arranged for you. Current lung screening recommendations suggest screening has more benefits than harms for people who are at high risk for lung cancer. People not at high risk should not be screened, and people eligible for lung screening will be given information to help decide if screening is right for them. This includes the possibility of the scan finding other changes not related to your lungs, and the amount of radiation exposure involved with each scan. The screening navigator will take the time to answer all of your questions. Don't forget, there are ways for you to reduce your risk of lung cancer. If you smoke, quitting can greatly lower your risk of developing diseases, including cancer. Quitting smoking also lowers your risk of dying early. Quitting can be hard, but it is possible, and you're more likely to quit if you get help. If you smoke currently, you will be offered free services to help you quit smoking at your screening appointment. Even if you do not qualify for lung cancer screening, you will still be offered help. You do not have to quit smoking to be screened for lung cancer. Quitting smoking is your choice. It's time. Book an appointment with your doctor or nurse practitioner to discuss the right screening at the right time. For more information, go to www.hsnsudbury.ca/cancer screening. Please consider sharing this video with your friends and family. They too may benefit to hear that it's time for cancer screening.